Good afternoon. This is Brendan with Blue Tiger Massage. I wanted to talk about the issue of pain. As you know, massage is useful for a variety different types of pain. No matter what the mechanism for pain is, studies have shown that massage can be effective with reducing those conditions of pain. And I wanted to talk to you about a couple different types of issues with pain that massage can help with. Massage is very good at helping people promote relaxation. Any type of pain information received by the brain that signals a threat to survival and so triggers that fight or flight response in your sympathetic nervous system can be reduced with massage. So when people are stressed, when they're all bundled up in stress and anxiety over daily life, or with an emotional issue, or with a physiological issue, increase in blood pressure happens, heart rate increases, in blood flow to voluntary muscles like the heart and the lungs can be affected, all which can become an issue if it becomes a chronic issue, which means it's more than an acute, or it's longer lasting than an acute phase. So acute is like maybe up to a month of an issue. Chronic, we tend to see like numerous months of happening. With chronic conditions can lead to things like illnesses and diseases. The norepinephrine is a big neurotransmitter that mediates that fight or flight response in your body. Basically what happens with massage is you have the two types of nervous system, the parasympathetic and the parasympathetic and the sympathetic nervous system. The sympathetic part of your nervous system is that part of your nervous system gets triggered, that fight or flight response, and that norepinephrine chemical levels tend to increase and decrease based on how healthy you are and your body's ability to cope with that stress. So everyone's got different stress levels. And some people's norepinephrine levels start to become low if they're in a chronic state of stress or anxiety. And what massage's goal is to, and I'm looking at my notes here because I think this is important, that we break that pain cycle. And basically, for those that don't know what the pain cycle is that persistent cycle that triggers muscle spasms, which cause decreased blood flow and a buildup of toxic metabolic waste in the tissue that leads to pain, and which then triggers more muscle spasms and the recurrence of that cycle. So basically, it's that never-ending cycle that kind of produces pain and spasms in your muscles, which could, basically hinder your ability to make that chronic condition into an acute one, or to get rid of that acute or chronic condition. And the two main last things I wanted to point out about pain with massage and managing that is so there's the spinal cord is what is the main terminal in which pain is from anywhere parts of your body. The pain messages are delivered through your spinal cord, and the spinal cord has a limited ability to attend to multiple sources of sensory stimuli at one time. So if pain is the main stimuli that's going on in a chronic condition at one time, pain stimuli traveling can be blocked out, basically caused by massage when it's traveling to the brain. So that dull, that aching, that dull, achy pain that you may get, which is those messages to your brain from the pain stimuli, gets blocked with massage. So that's a reason why massage is a great thing, is that it can block those messages of pain. And when we use thermal applications, so there's cold and there's hot thermal applications we can use to block pain for all types of conditions. And this has been a well-researched area in massage and in medical application of massage. And the last thing I wanted to talk about was that trigger points and the hypersensitive spots that sometimes people go, oh, I have a spot right here. Can you just like touch that? And typically trigger points can be either within the muscle or within fascia, which is the connective tissue, the most abundant tissue in our body. And basically what these trigger points can do, it's kind of like this shirt right here, and I think this is a great example, is when you grab this shirt, so we'll call this the trigger point, see what happens to all of these wrinkles right here, and you could kind of think of this as your fascia or your muscles, either or. When you grab the shirt, it's pulling from back here, it's coming to a grip right here, and you can see that it pulls from all sorts of areas. And when these taut bands of muscle or fascia in your body get that way, basically that's why people can feel pain. If it's coming from one area, it could affect other areas. And the whole point of massage is to make those shortened muscles that can do less or no work, to get rid of that and to elongate and basically stretch those muscles. And there's some times where muscles are actually too stretched, but we'll talk about that in a different video. But for now, in terms of pain management and massage, and what massage can do for pain is a lot, and I hope that I explained that very well to you today. But if you want to talk about your pain, I'm very enamored with pain in people's bodies, and like to be your advocate in terms of creating a baseline for you to measure that pain and to see how massage can help with that. Massage is not an end-all cure-all, but it definitely can help get you to a road where you can travel by yourself or with me or another person to success. So I hope that helped you a little bit as it helped me. Thank you for viewing this, and we'll see you at your next massage appointment. Thanks.